Hi, Mr. Fisher. I'm Hannah. I'm a UNCW student nurse. I'm going to be doing a head-to-toe assessment on you. It'll take 20 to 30 minutes. Is that okay?
Yes.
Can I verify your name and date of birth?
Paul Thomas Fisher, May 6, 2002.
Great. And I would perform hand hygiene and ensure privacy. So first, I'm going to inspect your skin. So if you could stand up for me. And could you lift your shirt up, please? Thank you. His skin is pink, and there are no signs of lesions. I'm going to feel your skin, if that's okay. His skin is warm bilaterally, and I'm going to pinch right here on your collarbone. And his skin moves easily, and the turgor is less than 3 seconds. All right, you can have a seat. There are, can I see your hands, please? Sorry. There are no signs of cyanosis, edema, or pallor. That's bilaterally. Okay, I'm gonna move on to inspect your head. That's your hair. That's okay. His hair is a black brown, and I would have gloves on. His hair is a wavy, straight texture, and there's even distribution, no signs of lice, flaking, or lesions. All right. So next I'm going to move on to your nails. So can I see your hands, please? His nails are round, smooth, uniform, and the nail beds are pink. His capillary refill is less than 3 seconds. And your toes. His toes are the same as his fingernails. They're smooth. His nail beds are pink. They're uniform, and his capillary refill is less than 3 seconds. All right, and I would do hand hygiene again. So now we're going to move on to your head. So his head is normocephalic, and it is symmetrical. Right, and his facial features are also symmetrical. So I'm going to touch your ears, if that's okay.
Yes.
And tell me if there's any tenderness through any of this. I'm feeling his pinna, his tragus, and his mastoid process. There is no swelling or redness. They are all symmetrical bilaterally, and no pain or swelling. Here is it, swelling. All right, so now I'm going to perform the whisper test. That's okay. Can you stand up for me? And then turn that way, please. All right, I'm going to whisper 3 words on each side, and then just repeat them back to me.
Like, after you say them?
Yeah, I'll say 3 on one side, and then repeat those 3, and then I'll move to the next side, say 3, and you repeat this.
Okay.
Okay.
Blue, red, green.
All right.
Banana, apple, strawberry.
Perfect. All right, you can have a seat. All right. Now I'm going to move on to your eyes.
Okay.
Okay, you will look at me. His eyebrows are symmetrical. Sorry about that. His eyelids are smooth. His sclera is white. His cornea is clear. Will you pull down on your eyelids? Yes. His conjunctiva is pink. All right, you can let go. There are no signs of lesions or drainage. All right. So now I'm going to perform a few tests on your eyes. So if we don't have a Snellen chart, if we did, he would stand 10 feet away, and he would cover one eye, and he would read the lowest line, and then he would switch eyes and then read the lowest line with that eye, and that would tell how well he can read from a distance. And the normal is 20/20, It can be better than that. It can be like 20/10, and if so, that means at 20 feet, he can read what a normal person would read at 10 feet. And if it was worse, like 20/50, it means that at 20 feet, a normal person could read that at 50 feet. We also do not have the Rosenbaum test. If we did, he would hold that at reading distance in his hand, and the normal is 14/14 for that one, and that tests his near sight. So now I'm going to be testing your eyes. So, okay, so first I'm going to ask you to look at the wall for me, and I'm going to bring my finger in front of your eyes, and whenever you see my finger, just look at it, okay? So, one more time. All right, good. So now I'm going to reach behind your head and pull my fingers into your peripheral, and then just say now whenever you see them.
Now. Now. Now.
All right, good. And then just follow my finger. Okay, good. And that was testing his eye muscles, and they worked smoothly. Now I'm going to test your pupils, so I'm going to turn off the lights. All right, so the first time I move the light, I'm going to be looking at the eye closest to the light, and then the second time I will be looking at the opposite pupil. Ready? Good. And these tests all equal parla. So next I'm going to move on to your nose. So I put on gloves. So I'm going to palpate, and if there's any tenderness during this, just let me know. His nose is midline, no signs of tenderness. His sinuses are not tender, and there are also no signs of of swelling. Now I'm going to look inside your nose. His septum is midline. There's no signs of redness or polyps. All right, and onto your mouth. His lips are pink and moist, and will you smile? His teeth are clean, and his gums are pink and moist. All right, and open your mouth. His tongue is pink, moist, and smooth. His mucous membranes are also moist. And again, and stick your tongue out for me. His oropharynx is pink. His uvula is pink. And will you say ah for me?
Ah.
All right. And it rises with phonation. I'm blanking. His hard and soft palate are pink, and his his tonsils are present and pink with no signs of redness or swelling. All right. Now I'm going to palpate your neck, if that's okay. Right. His cervical lymph node is not present. If it was, which means there's no sign of lymphadenopathy. If it was present, we would make sure that it was round, non-tender, and movable. And his trachea is midline. All right. Do you mind taking your shirt off? Alright, will you do that for me, please? And then will you lay on the pillows for me? There are no signs of jugular distension. There is also no pulsation, heaves, or lifts. Alright, since you're already laying down, I'm going to move on to the abdomen. So if you will just lay down for me. Actually, yeah. Alright, I'm going to take this pillow from you. Alright, so there are no signs of pulsations. His abdomen is flat and symmetrical. So now I'm going to listen to his abdomen. Using the diaphragm. Right, and his abdomen was normal active times 4. Oh, next I'm going to listen to his renal artery, then his aortic artery, and then his iliac arteries. Using the bell. Alright, there are no signs of bruise there either. So now I'm going to feel his abdomen. Are you ticklish?
No.
Alright. Alright, there are no signs of masses, and there is no bladder retention. Alright, if you will sit up for me now. Alright, so now we're going to move on to listening to his lungs. You will sit up a little straighter. And I will listen to 6 places on the anterior, 8 places on the posterior, and 2 lateral. With the diaphragm. Then laterally. All right, and will you kind of turn that way? See that? he breathes with ease, and there are no adventitious long sounds. His breath is clear. Okay, now I'm just going to, if you will just breathe normally for me for a few seconds. All right. His breath rates per minute was 12, and this is low, but because he is an athlete and he works out daily, this is normal. All right. So now I'm going to move on to your cardiac tests. Could I see your wrist for me? Okay. I'm going to test his pulse rate. All right, his pulse rate was 51. This is normal. Again, this is kind of low, but because he is an athlete, it's normal. All right, next I'm going to just feel your pulses throughout your body. That's okay. And I would do this bilaterally, but I'm only going to do it on one side. That's his carotid artery, and then his brachial pulse. His radial pulse. His popliteal. His posterior tibial, and then his dorsalis pedis. All right, those are all normal and a 2+. Next, I'm going to move on to listening to his heart. Oh, before I do that, I forgot to do his anterior transverse ratio. If you will lift up your arm for me. And the ratio is 1:2, so that's normal. No signs of barrel chest. So now I'm going to listen to his heart. First, feeling for his suprasternal notch, and then his angle of Louis, and then going out to the second intercostal space. And this is the aortic area, where S2 is louder than S1. Then, can you lift your head up for me? Then his pulmonic area, where S2 is louder than S1. And then Erb's point, where S1 and S2 are equal. And then the tricuspid area, where S1 is louder than S2. And then the mitral area, where S1 is louder than S2. And then I'm going to switch to the bell and listen for the apical pulse. You would do it for 1 minute, but then we're just going to go back the way we came. And there we're listening, was I yelling? We were listening for any abnormal heart sounds or murmurs. And so now I'm going to listen to his carotid artery, and I'm going to ask him to hold his breath, and I'm listening for bruits. And I'm listening with the bell. So I'm going to start on this side. Will you hold your breath? All right, and breathe. And then hold it again. All right, good. There were no signs of bruits. That would be a swooshing sound if they were present. All right. Okay, now we're, you can put your shirt back on. Okay, now we're gonna move on to your range of motion. So first I'm going to feel your muscles. And his muscles are the same size and tone bilaterally, and so they're symmetrical. If you will stand up for me. So first I'm going to start with your jaw. So open and close, and then move, if you can move it forward and back. All right, good. Then your neck. Will you turn your head side, the other side, right? And then reach your ear to your shoulder, and then the other side. Good. Will you bend down and touch your toes for me? And back up. There are no signs of scoliosis, and his spine is midline. All right, will you take a few steps for me? I'm just gonna watch you walk. Right, and back. Good. And then will you put one toe in front of the other? All right, good. So his gait was smooth and effortless. His posture is erect, and the toe tested his balance. While we're also testing your balance, we're going to do the Ronberg test. So will you put your arms by your side and your feet together and close your eyes? And we would do this for 20 seconds. But we're not going to do it that long. All right, you can open your eyes. And that should come back negative. So his balance is good. Okay, so back to the range of motion. Will you reach kind of like, yeah, perfect. And the other side. All right, good. And then will you bend forward and then back up? All right, good. Now to your shoulder. Will you flex and then extend, and then hyperextend? Good. And then abduct and adduct, and then circumduct. All right, good. And then your elbow. I think I'm out of this. Let me do this side. Okay. Flex, and then extend, and then pronation, and supination. And wrist. Will you flex, and then extend, and then hyperextend, and then go like this, and that's testing back and forth. That's good. And that's testing ulnar and radial deviation. And then with your fingers, will you flex them and extend them, and then adduct. Right, thank you. Okay, stay on this side. With your hip, will you bring it out to the side? So abduct and then adduct, and then extend. Flex and then extend, and then take a step forward. And then behind you, hyperextend. All right. And then will you do an inversion and then eversion? Alright, good. Alright, and then you take a step forward. Right, do just a squat up and down. Right, good. Okay, you can have a seat now. Then will you lift your leg up? Perfect. Okay, will you dorsiflex and then plantar flex? And then will you invert your foot? Yeah, like try and look at your, and then eversion. Good. And then, I always think I'm missing something. Okay. So now I'm going to test your strength. So will you grab my fingers and squeeze them? All right, good. And then now pull me forward. All right. And then push. Good. And then will you lift your legs up? Now pull back. All right. And push forward. Good. All right. And that is 5 out of 5. And it's equal bilaterally. Okay, now we're going to move on to your neurological tests. So I'm going to ask you to close your eyes and, well, you can open them now. And this, you can see your hand. This is pointy and this is soft. So I'm going to ask you to close your eyes and I'm going to touch you in random spots and then you tell me if it's pointy or soft.
Pointy. Soft. Pointy. Soft. Pointy. Soft. Soft. Pointy. Pointy.
All right, good. All right. I'm going to ask you, I'm going to stick my finger out in front of you. So you're going to use your finger and touch your nose and to my finger. And you're just going to do it like as I said. Right. Finger, nose, finger, nose, finger, nose, finger, nose. All right. I think that's everything.
No reflexes.
All right, actually, no, I lied. I'm going to need to test your reflexes, and then I think that will be everything. All right, so first, well, I do not have the hammer, so I'm just going to explain what would happen and where we would perform them. So the first would be the tricep reflex, and so you would go about 2 to 3 inches above the elbow, and you take the hammer, and you'd ask them to put all their weight into your hand, and then you would hit right there, and it should elicit a twitch of the forearm. And then next would be the reflex, and you would take the hammer, well, you would take your thumb and put it over the tendon, then take your hammer and hit your thumb, and that would elicit a flex of the forearm and the fingers. Then you would go to the radial reflex, and you would go about 2 inches above the wrist, and you would hit right there, and that would elicit a twitch of the fingers. Then you would go to the quadricep, which is the most common reflex, and you would they would be dangling their feet off the bed, and you would hit the hammer right below the kneecap, and that would elicit a kicking of the foot. And then with the Achilles reflex, they would once again be dangling their foot, and you would hit the back of the ankle, and that would cause the foot to flex up. And then the last one, let me see your foot. The last one, you would take the opposite side of the hammer and start at the ankle and move up to the toe, to the big toe. And that should come back negative because you don't want their toes to curl. That's only in babies. All right. Now I think that's everything.
Nice.
Right. Is there anything else I can do for you?
No, ma'am. Thank you.
All right. Thank you. So with the breast exam, you want to tell your patient that this should be done once a month, 4 to 7 days after the menstrual cycle has started. And first, they should be standing in front of a mirror and have their hands on their hips and leaning forward, and they're checking the color for any rashes, dimples, lumps, lesions, anything out of the ordinary. And then after they've done that, then they put their hands behind their head and still leaning forward, they check for the same things. And then when actually palpating the breast, they're going to want to take the, there's glare, the 3 fingers, and using the pads of the finger, you're going to start on the inside. Start on the inside and palpate around the nipple, feeling for any lumps or masses. And then once you go up the tail of Spence, to tell them to really check there, because that's where most of the lumps are found. And then once they do that, they also should check their nipple for any discharge, because there shouldn't be any discharge coming from there. And if they do find a lymph node in the tail of Spence, then it should be round, movable, and non-tender. And you should inform them that this should be done once a year. Well, they should go to the doctor once a year, and have like a mammogram done to check for early signs of breast cancer. So for the female genitalia assessment, you want to make sure they have gloves on. And then you're first going to check for the inguinal lymph nodes. And you're going to want to palpate the inside of the legs, checking to see if there are any lymph nodes. And if there are, seeing if they are round, non-tender, and movable. And then you're going to check the skin and the hair, making sure there are no nits or lesions. Then you will use your fingers. We'll separate this part, and you will check the labia majora, labia minora, and the clitoris, checking for symmetry and making sure there are no lesions. Then you will move down to the urethra and the vagina, checking for redness, swelling, lesions, and discharge. You don't want to see any of that. Then you will move down to the rectum, checking for redness, swelling, any hernias or anything like that. That's all. So for the male genitalia assessment, you want to put gloves on again, and then you're going to check the, like with the woman, the inside of the legs, palpating for any lymph nodes, and if there, you don't usually feel one, but if there is one, you want to document the size, shape, tenderness, and mobility. And then you're going to check the skin and the hair, making sure there are no lesions or nicks. Then you're going to move down you're going to feel the shaft and the glands, checking that there are no, that it's symmetrical, no ulcerations or lesions. Then you're going to lift that up, and using these 2 fingers, you're going to feel around the testicles, checking for any lumps, also checking for any swelling or tenderness. Once you do that, then you're going to move to the rectum, and you're going to check for redness, swelling, hemorrhoids, anything out of the ordinary. Then you're going to teach them about the testicle self-exam, and that should be done once a month in the shower. And they're going to just feel with these fingers around their testicles, feeling for any lumps or masses. And that's all.